Hello, everybody. Very nice to see so many people interested in the presentation. My name is Margit Sutrop, and I'm greeting you from the Ethics Center at Tartu University. And we are having a guest today, Professor Amber Griffioen, who is at the moment sitting in a living room of Susimetsa Philosophicum at Pärnumaa, because she is a resident there. But she is actually a professor at the moment at Duke Kunshan University, which is a cooperation between Duke University in the United States and Wuhan University in China. And she's teaching remotely there, but she's going to move to Shanghai in autumn. But actually, she is living in Constance, which is the place where we met, because we were together also supervising one MA student who wrote an interesting dissertation on empathy and emotions. And we did this defense together in Constance about 5 years ago, I think, or a little bit more. It was in 2017, I think. And then today she's going to speak about a very interesting project that she is today working on. And perhaps I can mention that she has been in academia, but now also thinking to move outside academia to something that is called existential coaching. And I think Amber is going to talk also a little bit about this, give some kind of appetizer to us, what it means to do something that is also important for people and uses academic knowledge, but is not actually limited only to teaching students or increasing knowledge base. And this is also, I think, very much in line with the project at Susimetsa Philosophicum, which is the scheme where she is now having her residency in Pärnumaa, because Teda Rebok, whose scholarship she is having, had this idea that Susimetsa could be a place where people do philosophy just because it is a lifestyle. It is practicing philosophy, not so much preaching or theorizing or having some kind of defending the arguments, but it's also living according to your own values and doing things that is important for life, for yourself, and for many people who are actually wanting to understand either meaning of life or what is important for them, what is valuable. And I think this is just one field that is important, that pregnancy and pregnancy loss are very existential topics related to many emotions and play a big role in people's lives, whereas philosophy has not paid that much attention to this. So thank you, Amber, very much for this willingness to give a talk and for your interest in sharing your knowledge and your thoughts about this topic. Her presentation is going to be about 45 minutes, and then we all have possibilities to ask questions and discuss, and you can raise your hand or also write in chat if you have some comments, since we are all online. So thank you very much, Amber, and the floor is yours. And we are going to record, so I hope everybody is okay with that. Thank you.
Great. Thank you so much, Margit. And first of all, thank you to all of you guys for coming. Can you hear me okay? So like I said, or like Margit said, actually, I am currently making my way out of full-time academia. This is a decision that I undertook a few years ago, actually, already, trying to think about an exit strategy, as some of you may be familiar with who have been in academia for a while. And I've decided to go into what I'm calling existential coaching for reproductive struggle and life transition. You can find my coaching page here under compasswisecoaching.com if you're interested in hearing a little bit more about that. But needless to say, it has a lot to do with themes surrounding infertility, pregnancy loss, transition to parenthood, and so on. And one of the reasons I'm undertaking this is kind of inspired by my own experience with infertility and loss, and then eventually kind of childbirth trauma, parenting in your 40s, these kinds of things. And so this is something I'm sort of starting to get up and running right now. But it's sort of conceived of as a cross between what you may know as philosophical counseling, or in the German, it's called philosophische Praxis, and kind of life coach, the life coach sphere. And I just completed a course, a 6-month course in coaching, and I'll be doing a philosophical counseling certificate sometime in the fall. But we are moving to Shanghai. I'm going to stay on at DKU for at least a couple more years. They'll sponsor my visa. My husband got a job at the German International School there, so we're having some big life transitions that I've been thinking a lot about. And in any case, because I'll pretty much be focusing on teaching on the one hand and coaching on the other, I'm no longer kind of interested in making myself marketable or pleasing the academy in certain kinds of ways. And I say this just to emphasize that I want to do philosophy that makes a difference. I want to do philosophy where I can see sort of tangible results, or I can see why it matters. And that is one of the reasons that I'm talking to you about this today. That being said, for those of you who are in the academy and staying in the academy or pursuing a scholarly career, I think philosophy has a lot to say about pregnancy and pregnancy loss. There's starting to be some more work on this, but I think there's a lot to be done. And what I want to do today is to really motivate why philosophy should care about pregnancy and pregnancy loss. And if we get to it, if I don't talk too long, I'll tell you a little bit about the project that I've been working on here at the Tene-Rehbock Philosophicum at Susimetsa. So I'm going to run through some topics and say more about some than others. I'm going to collapse a few into one slide, but I will be trying to talk about the different ways in which pregnancy is relevant for philosophy, whether we're talking about definitions and conceptual analysis, whether we're talking about metaphysics and Mariology, philosophy of the self, identity, personhood, epistemology, social epistemology, decision theory, and my main area of research, philosophy of religion. I think philosophy has a lot to say about pregnancy and pregnancy loss in all of these areas, but I also think that our philosophical discussions outside of kind of pregnancy-related themes can be enriched and or complicated by thinking a little bit more about pregnancy. And so that's kind of what I want to talk about today. Now, why should pregnancy matter to philosophers? Well, probably if you're here, at least to some of you, I'm sort of preaching to the choir, right? You're here because you think pregnancy should matter to philosophy and to philosophers. But it might be for different reasons, right? Some of you might be a sort of like what I like to call the philosophical omnivore. So you think that everything is relevant to philosophy, right? It doesn't matter what the topic is. Everything is or can be the subject matter of philosophy. And so why not pregnancy, right? You might have a background in feminist philosophy, and you think, women's experience and input matters, or, we need to talk about the patriarchy, right? So you might be interested in pregnancy and philosophy of pregnancy for that reason. You might be in applied ethics, bioethics, and here, certainly the abortion debate, which is becoming yet again even more relevant, especially if, as I do, you come from places where reproductive freedom is being drastically limited right now. But also, when I teach my Chinese students, we talk a lot about pronatalist movements worldwide, um, and this kind of push for women to be having more babies for various reasons in various social contexts. So you might think, hey, these things matter. And so we have to talk about pregnancy if we're going to talk about these kinds of things. But I also think there's some less obvious reasons to talk about pregnancy in philosophy. First, when we really get down to what pregnancy is, it might end up throwing a wrench into a lot of kind of things that we hold dear. Um, so it might throw a wrench into our kind of traditional post-Enlightenment Western metaphysics of selfhood and identity. I think it might upset some really cherished ideas, or at least kind of pre-theoretical ideas in biology and psychology, and certainly as my own work is trying to kind of aim for in philosophy. Sorry, I need to change this real quick. Okay. Sorry. All right. Still not showing me. Okay. And I'm going to talk about some of that in a little bit. But also, pregnancy and pregnancy loss has been of relevance in the history of philosophy. So I've specifically done some work on Meister Eckhart's metaphors on pregnancy and the way that Eckhart characterizes God as kind of simultaneously a plenitude, kind of constantly birthing creation, and as a sort of abyss, a desert, a barren wasteland, right? And how these kind of you know images of God stand in tension with each other in a way that Eckhart wants them to stand in tension with each other. I've done some work on Augustine. Luther famously has a letter about miscarriage. Julian of Norwich has so much of the showings are about Jesus' mother and so on. So there's a lot. There's a lot there. I attended a history of philosophy of pregnancy conference a couple of years ago at the University of Dayton, and just the different kinds of presentations that there were, and the vast amount of discussion of pregnancy in the history of ideas is just fascinating. And so there is stuff to be done there. Um, but also, and for me, most importantly, how we understand pregnancy has very real practical and social consequences. So, whose insurance bills get paid? I'll talk about this a little bit more later, but there was an instance in the United States where a woman who had a missed miscarriage, that is, uh, the fetus never developed a heartbeat, but she didn't bleed out the fetus. Her insurance company refused to pay for her miscarriage treatment because they said that they only understand as pregnant those fetuses that have a heartbeat. So a woman is not pregnant unless the embryo or the fetus has a heartbeat. And since this fetus never developed a heartbeat, they said, you are not pregnant, and therefore we do not have to pay for your miscarriage treatment. So how we define pregnancy matters. Who gets certain benefits? Who gets medical leave? There's currently a debate in Germany about whether women who undergo early miscarriages should be able to take a certain amount of maternity leave. In the United States, who's getting criminally prosecuted and why? How we understand pregnancy matters for that. The metaphysics of pregnancy matters for that. And so I think, look, we as philosophers should have some skin in the game, not only because we have important conceptual resources, methods, and tools that can be really beneficial here, like we can actually, I think, make a difference. I think we have a moral duty to kind of, be in these kinds of discussions and these kinds of debates. And I think it might be a dereliction of duty to some extent to just say, oh yeah, not our job as philosophers. So, okay. we talked a little bit now about, why pregnancy, but I want to say a little bit more about why pregnancy loss specifically should matter to philosophers. So in general, there is a pretty significant cultural silence around miscarriage and other forms of pregnancy loss. We don't talk about it. And that is reflected, of course, also in the scholarly literature, especially in philosophy. Why don't we talk about miscarriage? I mean, I think there's a lot of reasons. I'm just going to go quickly through these, but I mean, first, we just don't like to talk about messy lady parts. We don't like to talk about bleeding bodies. We don't talk a lot about menstruation in the open. There's a huge lack of research on women's health. I was just reading the other day about this research where they gave pigs erections, and I was like, more research on boners, and we still don't know like why women get endometriosis and how to treat it. So, there's a lot of just patriarchy in the way that medicine gets conducted, in the way we talk about things. It complicates the abortion debate on both sides, I think. So things like early miscarriage are problematic for the anti-abortion movement, insofar as it's very difficult to figure out, where a pregnancy termination begins, and what is a miscarriage. But also for the pro-life movement, or sorry, for the pro-choice movement, I think there's a tension that I'll talk about later, that a lot of women feel about grieving a pregnancy loss when they are accustomed to using the kind of rhetoric around abortion, like, well, it's just a cluster of cells and I should be able to decide what to do with my body. And so it creates these tensions that make us uncomfortable. And this leads to a certain lack of legal discourses around these things as well. There's an ambiguity that I'm going to raise again and again in this talk. Pregnancy loss is sad, but we don't know how to grieve it. We don't know what it is. We don't really understand what's lost in a lot of cases. We don't have the language to talk about it. And so we have this lack of therapeutic and spiritual resources that both cause and are an effect of the silence that results from this ambiguity. And there is a sense that there's a lot of discussion around pregnancy as a form of productivity. And this idea that pregnancy loss is a sort of failure to reproduce, and or to produce at all. This kind of reinforces a culture of blame surrounding miscarriage. A lot of women feel like it's their fault that they weren't able to bring their pregnancies to term. And a lot of the discourse around miscarriage also kind of reinforces that, to the point that people just kind of don't talk about it as much. Why should we be talking about it? Well, first of all, its naturalness. I'll return to this later, but I think that we have a tendency to think that the natural, and here I mean sort of the typical normal outcome of pregnancy, is the birth of a living baby. But the research, which of course is still somewhat lacking, but the research seems to show that anywhere from 60 to 90% probably of all pregnancies, if we count sort of starting at fertilization, do not make it to term. And so it is certainly not the norm that a pregnancy results in a live birth. And if that's right, then we're going to have to maybe rethink our notions around naturalness with respect to pregnancy. Metaphysics matter, right? And I think if we think about pregnancy loss, that can help us get a better grip on what pregnancy is. I'll talk about that in just a second. But also concerns of epistemic and reproductive justice. So women's testimony about their pregnancy losses is being ignored. There's a lack of hermeneutical resources to make sense of pregnancy loss. And there are clear medical and legal ramifications as well as practical consequences in the lives of women who suffer pregnancy loss that matter. Okay, so instead of talking about why we should talk about it, let's talk about it a little bit. I want to talk about some of the interesting and complicated ideas that come up when we start to think about pregnancy, especially in light of pregnancy loss. So first, when does pregnancy begin? You don't find a lot of discussion on this in the philosophical literature, with the exception perhaps of the abortion debate. But I've done a lot of thinking about this over the past couple of years. I'm still kind of trying out different definitions of pregnancy and of the beginnings and endings of pregnancy. But here are some possible candidates that you might hear about. I should note, by the way, if you go to different medical dictionaries and different medical textbooks, you get radically different accounts of what pregnancy is and when it begins. So one way of understanding when pregnancy begins on a very kind of biological notion is just the fertilization of an egg by a sperm, right? And this seems like a natural place to start when we're thinking about pregnancy. This would be a very expansive notion of pregnancy on the front end, right? If pregnancy began at fertilization. But as somebody who herself has undergone in vitro fertilization, you will know that in IVF and assisted reproduction, eggs are fertilized outside of the body. So not every case of a fertilized human egg is going to be a case of pregnancy. So we can't just say pregnancy begins when human pregnancy begins when a human egg is fertilized by a human sperm. Okay, well, maybe we don't say fertilization then. Maybe we say something like implantation. This is a very common definition in a lot of medical textbooks, implantation in the uterus. So when a fertilized egg successfully implants in the uterus, then you have a pregnancy. Again, a biological kind of underpinning here. But there are a few issues. So first of all, there are such things as ectopic pregnancies in which a fertilized egg implants successfully outside the uterus, and we call them pregnancies. There are certain chemical and embryonic pregnancies, used to be known as a blighted ovum, that never successfully implant, but you do have a fertilized egg sort of in the human body. And if you're like me, so on our first round of IVF, we transferred 2 embryos into my uterus, and I bled them out within a few days. And there is a real question about, look, you have an embryo inside you. Are you not pregnant in some relevant sense? But if it doesn't implant, then you wouldn't count as pregnant. Now, some medical dictionaries actually take clinical confirmation as the beginning of pregnancy. So they have this more epistemic understanding of pregnancy, which would be either via the detection of a heartbeat or in a lot of cases, detection of, say, certain elevations of HCG levels or something like that on a blood test. And, this seems all right. It might allow for some of these other pregnancies that I mentioned above that get excluded by the implantation in the uterus. But certainly we think people can be pregnant without knowing it. And we can imagine a case in which somebody goes, doesn't go to the doctor, never has their pregnancy confirmed. But at some point, we still think like, yeah, but they're pregnant, right? Now, there are some benefits to this kind of idea. So there's been a suggestion of talking about like pregnancy period pills instead of abortifacient. So a woman goes to a doctor and says, hey, I'm not having my period. I would like to get my period back. They don't do a pregnancy test. They just say, yes, we're treating you for amenorrhea. They give you a period pill, mifepristone, misoprostol, something like that, and you get your period back. So without clinical confirmation, you're not pregnant. And we're just talking about menstruation, not about pregnancy. Here's my preferred view on the beginning of pregnancy, but it's not without its own problems. I like to say a person becomes pregnant when a fertilized human egg comes to be in a place in the human body where it could successfully implant. So it's this kind of modal notion. It doesn't actually have to implant for you to count as pregnant, but it does have to be somewhere where it could, in theory, successfully implant. I choose this expansive notion because I want the work that I do on pregnancy to be something that is accessible to everybody, to people all across the kind of political spectrum on abortion. Um, and I think this gives a very expansive notion of pregnancy. My concerns are twofold. One is not necessarily a concern, but it is an implication, which is that the large majority of pregnancies will likely not result in a live birth if we really take this expansive understanding of what pregnancy is. And there are worries that I have about the practical and legal abuses of such a definition to restrict reproductive freedom. So I like this definition for the way that it includes women who have undergone IVF, the way it includes ectopic pregnancies, the way that it allows for being pregnant and becoming pregnant in different ways. But it's still going to exclude, like, you can't just swallow an embryo or inject it subcutaneously or something like that and count as pregnant, right? So it's going to exclude that because of the modal condition. Now, I like this view, but again, I am worried if we make this our understanding of the beginning of pregnancy, how that can be used, especially in cases where women are being prosecuted for having miscarriages. Um, okay, so we talked about beginnings. What about ends? When does pregnancy end? Well, here are a few candidates on that front. The obvious one, right? Birth of a live human being. And this, if you go to some of the philosophy of pregnancy folks, I mean, this is what you'll hear in a talk about pregnancy. They'll give some conception, no pun intended, of when pregnancy begins, and then they'll say, and it typically results in the birth of a live human being. But of course, this excludes all pregnancies that result in a pre-birth death. And inserting typically is not going to help here because, as I've noted, it doesn't seem typical for human reproduction that fertilized eggs make it to term. So this doesn't necessarily seem like our best candidate, especially if we want to take seriously the presence and prevalence of pregnancy loss. Another possibility, sort of inspired by Jen Skuro's really fantastic book called The Pregnancy Does Not Equal Childbearing Project. The first half is a graphic novel chronicling her experience of pregnancy loss. And the second half is like a phenomenological investigation of pregnancy loss. And she comes to the insight that all pregnancy involves loss, and that everyone who is pregnant will someday be postpartum, regardless of whether the pregnancy results in a live birth or not. So here we might think, we could say something like, she uses the word expellation, but like any expellation of a human biological entity from a pregnant person's body. I like this view. It does have the implication that you are still pregnant even if an embryo or fetus inside you has died. Some people might like that. Others might think, no, the pregnancy has been lost when the embryo or fetus dies. I kind of like the idea that you're still pregnant when that's inside you, but it's complicated by these cases of fetal resorption. So cases in which the fetal tissue or embryonic tissue is sort of reabsorbed and reintegrated into the body of the mother. So there's never an expellation. It's also complicated by pregnancy loss of a twin or multiple. So like if you're pregnant with twins and one of them dies, you've certainly lost a pregnancy in some sense, but you're still pregnant. So how many pregnancies can there be at one time in one pregnant body? And these counting cases, I think, are really interesting. We're going to come back to that. One final possibility I'll mention here, I like this one too, but it might be too expansive, is the cessation of biological dependence on the parent. whether because it dies or ceases to develop or grow, or because it's birthed alive, or I don't know. I mean, a lot of women talk about the so-called fourth trimester, in which the mother and the baby, or the parent and the baby, are still very, very closely attached. This is certainly not the case in all pregnancies and births, but certainly a newborn infant is deeply dependent on their parents or caretakers for their continued existence. And so, maybe this kind of understanding of pregnancy, I mean, on the one hand, it might be more relational, it might incorporate other agents, it might incorporate the fourth trimester, but it might also be like too expansive. A lot of people think like once you've had live birth, like that's the end of pregnancy, you're not pregnant anymore. I just like it as a possibility. It's nice to throw it in there. Okay. I talked about this counting problem, one pregnancy or two. Well, there are other counting problems. So I'm just going to mention this one briefly and move on. But pregnancies are usually dated to the time of the pregnant person's last menstrual cycle. This is usually just a pragmatic matter for doctors to have a sort of system that's supposed to be, applicable to many women. But it has this super bizarre result that when you get clinical confirmation of your pregnancy, you're probably going to count as having been pregnant before a fertilized egg ever came into existence, before you had sex, before you had IVF, whatever, because they will count you as pregnant starting at your last menstrual cycle. So upon confirmation, you suddenly become pregnant, or you count as having been pregnant for a time before there was ever even a fertilized egg anywhere near your body. And this is very troubling for places that have 6-week abortion bans in place, because a lot of women just simply do not know that they are pregnant at 6 weeks, either because they have irregular menstrual cycles, so they just kind of are waiting for their period to show up, and by the time they find out they're pregnant, if they count back to their last menstrual cycle, it's been more than 6 weeks. Or in my case, for example, you have a miscarriage and then you end up getting pregnant before you have another menstrual cycle. And so even though I could tell my doctors, no, 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 I had sex one time, I know exactly when this baby was conceived, it like broke their brains. And they had real difficulties during my pregnancy, sort of understanding, okay, is this fetus meeting, the developmental benchmarks at this fetal age? Because they didn't know how, they could not measure by the usual standards how far along my pregnancy was. So super weird implications there. But there are more counting problems when we get to the metaphysics of pregnancy, when we start to think about what pregnancy really is. And so there's two really sort of predominant models in the metaphysics of pregnancy right now. I take it to be sort of the intuitive model that a lot of us kind of come to the table with when we think about pregnancy. This is called the container model of pregnancy, most famously kind of put into print by Smith and Brogard, who compared the fetus, otherwise known as the foster, as being contained within the maternal organism, also referred to as the gravida, like a tub of yogurt inside a refrigerator, or you may have heard in English, having a bun in the oven. Right? They also compare it to a tenant in its niche. On this view, the pregnant woman is a container, an incubator, a temporary house for another organism. But there are two substances. They don't share any parts in common. Granted, the placenta gets a little tricky here because the maternal organism grows a new organ and is connected to it, and the fetus depends on that organ for its sustenance. But in theory, the idea is the pregnant body is a container containing the fetus. This is very pre-theoretically intuitive, but normally in these other cases, like yogurt in the refrigerator, bun in the oven, tenant, niche, you have two different kinds of things. One thing is contained within another kind of thing. That doesn't necessarily seem to be the case in pregnancy. So we might say, okay, is this the best analogy or not? More recently, Elselijn Kingma, who's headed up the research project that has the best acronym in the history of research project acronyms, namely the BUMP project, Better Understanding the Metaphysics of Pregnancy. So Elselijn has this view that we shouldn't think of the relationship of foster to gravida, or fetus to maternal organism, as a thing in its container, but rather the foster is a proper part of the gravida. And she makes reference to the ways in which fetuses are really like physiologically, functionally, immunologically integrated into and or accommodated by the maternal organism. And the ways that the fetus and the maternal organism are intertwined. And this certainly has really interesting implications for abortion, surrogacy, other debates. There is a question, and this is something in debate sort of in the philosophy of biology, and it's going to be interesting to see where this goes. Also debate in mereology. Can a substance of a certain kind be a proper part of another substance of that kind? One possibility is to say, no, that's not possible. Therefore, the fetus can't be a proper part of the gravida. Another possibility is to say, no, they're two different kinds of things. A fetus doesn't become a human being until much later. And another possible response is maybe if we take pregnancy as the rule and not the exception, we would see the ways in which a thing of a certain kind can be a proper part of something of the same kind. So when we think about pregnancy loss, this is something that has been relatively neglected by people working in the metaphysics of pregnancy, but I think it's really relevant, both in terms of getting at what pregnancy is, in terms of beginnings and endings, but also thinking about these issues, both from a phenomenological standpoint and what it would mean for pregnancy loss. On the one hand, because we operate, I think, with the container model so much, there is this kind of sense that, you can make sense of grieving the fetus. It was this thing that's separate from you, but that you grew to love, and then you lose it, it dies, and you mourn it like another human being, and so on. And there's a lot of resistance, I think, to the parthood model on behalf of women who have undergone pregnancy loss. But I don't know, when I think about it, it really does seem in pregnancy loss, at least to me, that there is a real sense in which you could say you lose a part of yourself. And we'll talk about this in just a second. But there are also, we talked about fetal resorption. The phenomena of microchimerism is really interesting. So when a woman is pregnant, some cells and DNA pass between the mother and the fetus. So from the mother to the fetus and from the fetus to the mother. This means not only does, your fetus have your DNA, your fetus really has, and your child has cells from you in them, if you have been pregnant. And also, and this is what always gets me a little bit like choked up, but like the thought that in the pregnancies that I lost, it's very likely that somehow those cells, their DNA, something from them is still in my body and will be potentially for decades, maybe for the rest of my life. There's something really comforting about that fact. And I think that makes a little bit more sense in this kind of integrative parthood view. And the experience of pregnancy loss, and for some people birth, often involves a sense of the disruption of bodily integrity. It's not just like you're removing something from a separate space. I had a C-section, and so literally something was kind of removed from my space in its uterus. But at the same time, I can feel them moving my organs around during the surgery. And there's this very real sense in which I could feel the baby moving. There's something like all of a sudden there was this part of me that was no longer there. And so I think the parthood view can make sense of this. But we're going to have to think a little bit more about parts and the ways that we grieve pregnancy loss, because we normally don't grieve. We grieve the loss of like an arm or a leg, a hand or a foot, an eye. We do grieve losing parts of us. but not necessarily in the way that we grieve a pregnancy loss. And so maybe this just involves a reconceptualization. But there is something to pregnancy loss that seems to go beyond just, losing a part. Maybe it's the just or the mere in there, the just losing a part. In any case, it's something to think more about. Okay, I'm going to move through this pretty quickly, but it is important for me to think about the ways in which pregnancy and pregnancy loss are deeply transformative experiences. So some of you are probably familiar with Lori Paul's book on transformative experience. She also wrote the article, I think it's called What You Can't Expect When You're Expecting, in which pregnancy is sort of the central case or central example of experiences that are so transformative that you don't know how you're going to be on the other side, right? The person on the other side is going to be so radically transformed. They're going to have different preferences, different concerns, different relations, and so on. And so she thinks, actually, we can't make a rational decision based on our current preferences about whether or not we should, for example, get pregnant or have children, because we don't know what it's going to be like on the other side. You can't understand what it is to be pregnant until you've actually been pregnant. So there's something that is deeply epistemically transformative about pregnancy. And I think something similar can be said about some cases of pregnancy loss. There's also, again, the sense in which one is sort of intertwined or entangled with the fetus in a way. One's concerns become split between the body and one's projects, as Iris Marion Young puts it, between past and future. A unique body subjectivity, which is difficult to empathize with unless one is or has been pregnant. Now, I do have some misgivings about the claim that, like, you can't make an informed decision or you can't, make policy without knowing what something is like. I don't think that that's true, but I do think that you probably shouldn't make policy, at least, unless you have been informed by people who do know what it's like, unless you're taking seriously the testimony of people who do understand and have moved from just kind of having the factual information to actually grasping that. There are also other ways in which one is deeply entangled or entwined in pregnancy. For some people, pregnancy is like an invasion. It's like a parasite, a virus. There's a really good book called, I think it's called The Natural Mother of the Child by Chris Malcolm Belk, a transmasculine person who talks about how his gender dysphoria was heightened in all these ways by pregnancy and breastfeeding, but really talks about this transformation of going through pregnancy. And so this is from an epistemic standpoint, from the standpoint of standpoint epistemology and social epistemology, very, very important. And that sort of brings me to the project that I'm working on in my time here. Well, I'm doing what I can on the project right now. I also had to prepare a syllabus last minute, retool a complete syllabus because it turns out I need a hysterectomy in 2 weeks. And so I'm kind of scrambling to get everything done and taken care of while I'm here. And it's really great to have the space to do that. So thank you to the Teda Reebok Philosophicum residency program for that. But here's sort of what I'm working on and a little bit of what I've written so far. So to begin with, I talk about the ways in which pregnancy loss involves a deep epistemic rupture. Miscarriage, especially early pregnancy loss and miscarriage, is sort of characterized by a deep ambiguity. And as I've mentioned before, there's a lack, because of the cultural silence surrounding it, because of the lack of sort of hermeneutical resources, there's also a lack of social and spiritual scripts or rituals for grappling with and mourning pregnancy losses. There are questions, especially in early pregnancy, about what it is that's lost. We talk about embryos and fetuses and so on. Um, but there are very real questions about, was it a human being? Was it a life? Did it live and therefore die, or did it just sort of cease to continue to develop? So, a lot of the language that medical professionals use in cases of early pregnancy loss are things where they won't say it died. They'll say it stopped developing. It's not going to be viable. It's not going to develop a heartbeat. But they won't say there was this life that died. Um, there are questions about what it is that we're grieving. Are we grieving the cessation of the pregnancy? Are we grieving this thing potentially that has died? In a lot of cases, as Alison Reicheld points out when she calls pregnancy loss a sort of liminal non-event, we're not just grieving what was lost, what was bled out, or what was birthed or taken out, but rather the loss of an entire identity and future, right? The notion of oneself as a mother or a parent, um, this imagined future of this child, and so on. So there's a whole future aspect that is grieved when pregnancy loss occurs as well. But there are very real questions about whether there's something to be buried or memorialized, and there are legal restrictions around this. In Germany, for example, if the fetus is over 500 grams, I believe you are required to bury it, or is required to be disposed of properly. You can't just like put it in your backyard, for example, or bury it under a tree. Um, a lot of women don't have anything that they can bury, either because of fetal resorption or because, like in my case, it just, slipped into the overly efficient German plumbing before I could do anything about it, right? Um, and for others, you just have this little clump of blood. It looks like a period or something, and it's very difficult to figure out how to memorialize that. There are some really good and interesting techniques. I'm happy to talk to you about some of those in the Q&A if you want. It's also interesting that in Germany, if the fetus is under 500 grams or not hasn't reached the pregnancy hasn't reached the 24-week mark, you cannot get a birth certificate and therefore not a death certificate, but you can get what is called an Existenzbescheinigung, so a sort of certification of existence that you can put into your little German family book or your Stammbuch or something like that. And I find that really interesting, this idea, like we say that this thing existed and it's legal. The language that we use here, a lot of times we don't talk about birthing in cases of miscarriage. We talk about passing tissue, talk about miscarrying, carrying wrong. But there is a shift going on, at least in Germany, amongst midwives, to instead of calling it a Fehlgeburt, like a misbirth, they call it die kleine Geburt. So you have the stille Geburt of stillbirth, you have, live Geburt, birth, but miscarriage being characterized as die kleine Geburt. I think that's a very interesting and kind of compassionate notion. At first, I found it very disorienting, but now I've really come to see the importance of it. Um, and, does the grievability of miscarriage stand in tension with our views on abortion? Or for a lot of women who are religious, on resurrection? There's a lot of talk online about angel babies and, seeing your children again in heaven and so on. I always found this very disconcerting and very disorienting and so on. But for a lot of women, it's really important. And this sort of tension with my own view led me to write an article on it called Embryonic Afterlife. So if anyone's interested in checking that out, I talk about what an afterlife might look like for a miscarried embryo, for example, and what kinds of views we might have on the Christian thing. But I'm not going to be able to get through all of this. So just briefly to say sort of what I'm most interested in this project is, given this deep ambiguity and the epistemic rupture that happens in pregnancy laws. I call it a sort of rupture in meaning itself. A lot of women who undergo pregnancy loss are kind of left with an excruciating choice. Either to sort of navigate their suffering alone without the aid of social and spiritual support, or to force their experience into imposed conceptual frameworks that end up downplaying or distorting rather than kind of recognizing, clarifying, appropriately addressing the ambiguity and the badness of what those women have suffered. And a lot of people choose the first option. They navigate their suffering alone, especially in places like the US where reproductive freedom is being restricted. A lot of women are miscarrying in silence, at home, in their bathrooms, undisruptively, because they're afraid. But also a lot of women, at least religiously, they just say, no, I'm done. And they cease to worship. So it's a problem not for belief, but for deconversion. I'm interested in thinking about the cases in which both religion and secular society sort of create conceptual frameworks that are supposed to aid people in meaning making, but that I think end up doing more harm than good, or at least running the risk of doing serious epistemic and moral damage, both to those who suffer, whose testimony is not taken seriously, whose testimony is gaslit when they talk about the badness of their experience, or simply to say, oh, we're doing an intellectual theodicy. We're not talking to you. We're not talking about you. We're not talking to you. But I think it does very serious epistemic damage to those who suffer pregnancy loss. But it also threatens to reinforce certain intellectual vices in theorizers. So when we think about religious theodicies, I'm happy to talk about this in the Q&A some more. I do worry, as Dorothee Sölle puts it, that it's leading, or it has a tendency to lead to a kind of Verdummung und Desensibilisierung, an inability and an unwillingness to actually see suffering and take it seriously. And I'm going to just skip over this, but I think the post-traumatic growth paradigm in psychology is actually doing something similar in the secular realm. I think it's sort of theodicizing the kind of suffering, and there's an implicit normative component. Women are expected to grow from their pregnancy losses. They're supposed to be seen as a sort of necessary evil towards greater personal development and growth. And those who fail to grow are either ignored or, in some sense, blamed. And this, again, reinforces the culture of blame around pregnancy loss. So I'm not going to read this. I'm just going to stop, but I'll leave this up for those who want to read it. Basically, my concern is that there are these discourses around suffering and trauma that are really intended as tools for meaning making, but which end up sort of abusing meaning making, becoming not tools, but sort of weapons and instruments of epistemic violence against those who have suffered. And I have to thank Teda Rehbach for it, or whoever put Elaine Scarry's The Body in Pain on a shelf in the villa here, because I pulled it off the shelf and have been reading it for the last week that I've been here. And it's making its way into the paper that I'm writing. And I think, the stuff that she talks about where the ways in which tools can be used as weapons around pain is a very helpful notion for what I've been trying to bring to expression over the past couple of years. And so I'm very excited to be able to incorporate that into the work that I'm doing. But I'm going to stop there. I have ideas of like what we need. I'll talk about that if anyone wants it, but I think I've talked too much, so I'm going to stop talking and sit back in the chair and take questions or comments. But thank you all for being here and for listening so attentively. I appreciate it. I'm going to stop
Yeah.
sharing here if that's okay.
Thank you very much, Amber, for this very engaging talk. And yeah, I am sure there will be questions and comments. So please feel free to raise your hand, and I try to get the right order. Who has been the first?
Here, I'm going to get.
Yeah.
I'm here. I'm listening. I hear everybody. I'm just going to get over um, to the chair where I can sit down now a little bit. Okay.
Yeah. I'm just starting first because I think what I mean for Teda, the project that she was very interested in was good life. And
Mm,
the question could be just like I was thinking about when you were saying that what do we are actually mourning what is this loss about? Is it about the loss of some um, bodily condition? Is it the actual just like some sub identity of the child? Because you could say future child. I mean, the seed can be an apple, or is it the seed itself? I mean, this kind of discussion.
mm,
But I think what I more thought about was that you were saying that you're also missing the future, or this is what you actually put your thoughts in. But I mean, if I just try to relate it to the discussion about good life, I mean, pregnancy itself is not any fun. I mean, I have. You could say also that this is also related to some difficult conditions, and so, but you may actually, and the question is if the future child is part of your good life. I mean, it's just like so for some people it is threatening. I mean, they may think that having a child changes their life and changes their good life, and the others are hoping to get good life when they have a baby or an additional baby. So have you been thinking about how it relates to this? Because some may they just enjoy pregnancy, even if they are not having uh, this kind of abilities, or they are limited in the condition to do things, or they feel bad, but they still say this belongs to the life and this is a part of it, and they enjoy it. The others are saying this is terrible. So just like all these thoughts, does it play any role in your discussion about yeah, pregnancy in relation to good life? And also then of course the future step is if something changes and does not go so well. But I would like to make it separately or take it apart. Yeah, thank you.
thank you. Yeah, no, that's absolutely right. Can you still hear me okay? Is everything
Yeah,
good? Yeah.
everything okay.
Um, I think, I mean, so to some extent, this goes back to the discussion of the transformative experience aspect of pregnancy. And in this respect, I do think Lori Paul is right, um, that you really don't know what you're going and to some extent cannot anticipate what you're going to be like um, on the other side of a pregnancy. Um, and it is important to note that, not all pregnancies are welcomed, right, or experienced as pleasant. For some people, they're excruciatingly painful, or for people who have morning sickness throughout their entire pregnancies and so they can be very debilitating. Um, for some people, pregnancy loss is welcomed, right? So pregnancy loss is not always negatively valenced. I focus on instances of pregnancy loss that are viewed as grievable or as occasions for grief. But it is important to realize that for some women, it is a relief to have a miscarriage. It is a positive event where the pregnancy was actually sort of the negative experience. Um, and so the valence of these things can be radically different. As far as the good life is concerned, and this is where, like, I don't know what to say. I do think because pregnancy can be so different um, for so many people, and because it is, I wouldn't say necessarily transformative. There are people who have kind of resisted, and they're like, no, I'm pretty much the same person I was on the other side of pregnancy as I was beforehand. Um, I do think we need to be very careful about assuming that pregnancy or parenthood is part of the good life. And that's something like that kind of implicit norm around what it is to have a complete life, which is to, find a partner and then procreate and then, whatever comes after that. Um, I think we should resist that. And that's why I am, to some extent, very concerned about the pro-natalist movement, not only for its kind of heavily consequentialist approach, like we just need to have more babies, and so women need to be, cranking them out, but for this idea that uh, women who have not had children, or people in general who have not had children, but especially women, um, are lacking something. I think that's a pernicious idea, and I think it's being used right now as an instrument of rhetorical violence. So this idea of like childless cat ladies and things like that, and JD Vance. We have Xi Jinping talking about the new trend of family, trying to reestablish Confucian family values so that women are more likely to get married younger and have children. I think these kinds of things rest on these implicit notions that children and pregnancy and so on is part of the good life. And that's something that I am very hesitant to embrace. Yeah.
Okay, thank you very much. A very short comment, and then I give the floor to Reen and then Olga. I mean, my very brief comment is that I think it depends also whether we have objective theory of good life or subjective, isn't it? Because if
Yeah.
it is objective, then of course there needs to be some agreement or some kind of experiences or some kind of capabilities or whatever be just like conditions, whether they belong to good life or not. And then we can have this condition, and it may be, yeah, as in the same way as we could say that the capability to hear, for example, or to speak is something that belongs to the good life, and then deaf people are saying, "Are you saying that we don't have good life or something?" I mean, isn't it? This is the I agree. This may be the bad the bad outcome of it, that we, even if we mean it well and try to define what all belongs to good life, it may be for those who are missing something, then some kind of, as if appointing that they should feel bad. But when it is subjective, of course, then it very much, we are listening what kind of different models or ways of understanding of good life are, and then for some it is and for some not. And this should be acceptable, I think. Okay, but let us move on. Green circle, and then Olga, please.
Hello. Thank you.
Hi.
Thank you for a really interesting talk. And I, I find your move from academia to existential coaching really interesting. So I wanted to ask about that. Um, so I assume that the coaching you would like to do does concern situations like pregnancy loss. That's because I think you made a very convincing case in the talk that we haven't really even figured out how to speak about it properly,
Mm-hmm.
or also speak about it in a way that's helpful for people. And it's probably one of those areas where even this idea of grief is not often recognized. And I wanted to ask, like, what other kind of preparation do you do? Do you feel that you have to take an extensive, I don't know, psychological kind of a training to be able to do so? It's a partly personal question because I've often find myself like in the midst of students friends who want to be advised on something, and I often feel that, and I often have to start by saying, I'm not the psychologist, but I wonder, like, this is often I feel that, okay, if I would want to do it more seriously, I would have to get this extensive training, and I don't see how that's possible. So I wonder, how do you reconcile those different aspects of this possible future move, if you even think there is anything to reconcile there?
Yeah, no, it's a very good question. And it's one of my sort of central concerns once I sort of made this decision that like this is something I wanted to do. It was, I mean, one of my biggest concerns about coaching is that the coaching industry is kind of wholly unregulated.
Right.
And that is, on the one hand, that's highly problematic because like you can go online, you can call yourself a coach, and
Right.
magically you are a coach. And you need no expertise whatsoever as long as you can provide whatever, as long as you can make money from your clients, basically. On the other hand, it does open doors because you don't need to go through years and years of training. It allows for quicker career transitions if I think done responsibly. Now, my biggest concern is how do I know when somebody needs more help than I can provide? When should I pass people to a psychotherapist? When do they need psychiatric or medical intervention? Right. And I did a 6-month coach training with an institute in the UK called Animus Coaching. I picked them because they're a little more philosophical and a little more kind of theory grounded than a lot of other certification programs. But one thing I did come out with was a sense of, okay, I now sort of know what to do in terms of discernment and figuring out both when someone needs more than I can provide and how to kind of pass them off to somebody else or to help them find the help that they need. So that is one of my kind of central anxieties around going into the coaching space. And you're right to be worried about it. What I am trying to provide is a kind of guidance, and I explicitly say this on my website, and I say this when I take discovery calls with clients, which is I am not a fertility coach in like the traditional sense. Fertility coaches are usually trying to like help you get pregnant. I'm not going to magically make you pregnant or, make you happy or solve your problems. But my job is sort of to walk beside you as you struggle, and to give you some conceptual and theoretical and whatever kinds of spiritual resources, to be able to make your own decisions and to be able to kind of, struggle better in a very, very minimal sense of the term better. And so that's sort of how I see my role is really as, in Germany, there are women who actually do, they talk about being Begleiter of women undergoing pregnancy loss, of accompanying them. And while I'm not focusing only on pregnancy loss, I see myself as a sort of companion or somebody who's accompanying people on, now I'm using coach speak, right? People on their journey, as opposed to somebody who's there to kind of like provide solutions. But yeah, I am concerned, and I am thinking while I'm in China, we're going to be there for 2 to 6 years. And, do I want to do additional certifications? Do I want to do a master's in counseling or psychotherapy? Do I want to do Viktor Frankl logotherapy? But at some point, you have to kind of say, okay, but now I'm going to actually do it and not just, it can become an excuse after a while. So that's not a super concrete answer, but I think it's because I'm kind of struggling my way through this myself.
I don't know whether they offer this program there, but I think end of life doula might be kind of really could be helpful for this, but as elements of both worlds.
I did do I did a certification, like a 3-day training with a German Fehlgeburtsbegleiterin person who is like an end of life doula, but for women undergoing pregnancy loss. And I learned a lot about different things that midwives and doulas and people who are specializing in pregnancy loss are implementing to make these things to provide parents with resources to appropriately grieve these kinds of events. And so things like being able to place a very, very small, almost unrecognizable embryo in water, and you can preserve that embryo for quite a while in water, and you can kind of create a little like water grave for it. And there's, different kinds of things that you can do that allow people to have something a little more concrete to grieve, for example. And so, yeah, those kinds of trainings I'm definitely interested in. I'm going to keep doing. But right now, I'm really just trying to get ICF certified, get enough practice hours in. So if anybody is interested in some free or low-cost coaching or knows anybody who is actually grappling with some of these questions, also questions like, do I want to be a parent? Do I even want children? Should we be bringing children into the world? I am definitely looking for sort of practice clients right now, but I'm not here to advertise. So more questions in the QA, I think.
Okay, thank you very much. Olga, please.
Hello, hi, I'm Olga. I was pregnant about 6 months ago, and it definitely made me think of some of these philosophical questions. And I'd like to bring this like a little bit back to the definition part of the pregnancy. And I think like one of the things you specifically mentioned is that it's like when there is a possibility of that it will like develop into pregnancy, but it's like implanted into human body. And I was just like wondering, we probably don't have the tech now, but maybe in like a decade or two, we have something like artificial wombs, and like how that would change things, and also what that might do to the kind of like pro-life, pro-choice debate, where let's say you could be able to extract an unwanted fetus, but it doesn't mean that its life or potential life is over, where we can like freeze it or grow it to term in some other way.
Yeah, I think the question of artificial wombs and so on is a really interesting one. I haven't done tons with it in my own research. I know some people who have, who are affiliated with the Bump project that I mentioned. I mean, there's some really interesting possibilities with artificial wombs. I mean, on the one hand, you have the potential of a technology that could help those people who struggle with childlessness, whose childlessness is unchosen as opposed to chosen, for a lot of trans individuals who want children but do not want to undergo pregnancy or do not want to deal with the gender dysphoria of being pregnant, who want biological children but are unwilling or unable to carry a pregnancy to term. The majority of my female Chinese students, when I talk to them about having children, they are deeply concerned. I mean, granted, this also rests on problematic notions of body image, but they are deeply concerned about what it's going to do to their body as well as their careers. And so there's this whole potential there. But there's obviously dangers. I mean, even apart from like, eugenics stuff and, baby farms or whatever slippery slope you can kind of think of with artificial wombs. There are questions about whether, I don't know, I mean, whether we think that there is something, this goes back to Margit's question about the good life, whether there's something sort of valuable about the pregnancy process itself that might, while not ideal and artificial, that might get lost in that kind of process. I mean, I don't want to say that, I mean, even with adoptive parents, right, who don't go through pregnancy, I don't want to say that their kind of parent experience is somehow deficient because they didn't go through a pregnancy, because I don't believe that. But there are intuitions that a lot of people have about the sort of naturalness around pregnancy. But it's just so interesting because, one of the things, like, pregnancy is supposed to be hard, right? And like labor is supposed to be hard. And think about the whole discourse around natural childbirth and the fact that it's called natural childbirth, right? Where a C-section is somehow unnatural, where only vaginal birth counts and only without painkillers. I remember talking to a Danish friend of mine years ago, just being like, yeah, I think if I get pregnant, I think I want to have a natural child, but I don't want an epidural. And she was like, look, you take an aspirin for a headache. Why do you think it's important to go through pain to bring a child into the world and to like do that to your body? And I remember thinking at the time, I was like, oh shit, yeah, I don't, good point, So I think a lot of the notions that we have around naturalness are heavily normative in nature. And I'm not sure that we have good reason to hold them. And that's why I'm open to a lot of different kinds of reproductive technologies. One other thing to think of in this context is I've been thinking a lot about embryo donation lately. So there's been a lot of talk of like what to do with blastocysts and embryos created through IVF that don't get used. And it's one of those really interesting intersections where anti-abortion and pro-choice folks are still both kind of on the fence about this, or they don't really know what to say. But there was somebody who was telling me about, I think it was called like, it's called like compassionate disposal or something like that, but it's compassionate transfer was what it was called. And it was basically the idea that of transferring embryos during an infertile window into a living human being as a way of disposing of unused embryos. And I just thought, I was like, yeah, like my reaction was sort of like yours. I was like, what is this? And this is so interesting to me. And there's part of me that's like, yeah, if I can't or don't want to donate my embryos, the idea of like putting them back in my body, even if I'm not going to give birth to them, there's something to me very attractive about that. But there's also something very strange about that idea. And so, yeah, there's just tons of things that are interesting, relevant, controversial, tricky when it comes to these kinds of technologies. And we're going to have to face those sooner rather than later, I think. I think there's a question in the chat. Am I right? Yes, there's a question in the chat.
Please, can you read it? I don't
Yes, I can. I think it was a direct message. So There's a question. Hello, I have a question about not getting pregnant, conceiving, and accepting it. If we're not Christians and it's not enough to think or believe that this is how it has to be, what other philosophical ideas, solutions would be possible to make sense of this? Yes, I think that's a fantastic question. And it's something that I am directly sort of in the middle of trying to develop. So the embryonic afterlives paper is sort of the beginning of this thought process, which there I am sort of talking about pregnancy loss, but there's a lot of so to start with respect to kind of early miscarriage and so on, there's this problem of very weird heavens. So if we think a human life begins at fertilization, and if we think that most fertilized eggs do not make it to term, and we agree, I didn't get to read this on my slide, but we agree with Augustine that whatever lives can also die, and whatever dies has a share in the resurrection, at least amongst human beings, then it's very likely that heaven is going to be populated predominantly by human beings who have never taken a breath, who have never been part of the creation with which that they're sort of that was created for human beings to exist in. It's going to be a very weird heaven, and I think that in itself is just a bizarre notion. Augustine talks about himself saying, he says, clearly formed fetuses have lived and therefore died and have a share in the resurrection. But he says, what about unformed fetuses? He calls them abortivi and says, maybe they're just like seeds that blow away on the wind. So Augustine himself considered the possibility that early miscarriages are not deaths. And I think that's just a very interesting notion. I believe, though, the question is around sort of infertility as opposed to just sort of pregnancy loss and what's going to happen there. And the question was alternatives to the idea of believing that this is how it has to be. What I'm trying to resist in my theodicy critical work are these kinds of frameworks that says, well, this is just God's plan. God's plan for you is to not have children, even if you really want them, or it's all for some greater good, or this is an opportunity to become closer to God, an opportunity for divine intimacy. I am concerned about those kinds of approaches because I think they sort of turn the badness of the event itself into either a necessary evil or something implicitly good. And I am concerned about that. What are alternatives? One is lament, which from a Christian perspective is also very biblical. Taking seriously the idea that it is okay to grieve this, and it is okay to be angry at God if the childlessness is unchosen. I mean, I'm a big fan of Ivan Karamazov's rebellion, but that's because I'm pretty critical myself. One of the things that I am exploring right now are works by, I work a lot in medieval mysticism and thinking about the ways, especially that the women mystics can be useful in a spiritual sense. And here I think there are lots of resources and ways of thinking about suffering, of thinking about also childlessness, and other Christian figures who are childless, like nuns, right? And those who take vows of celibacy. There are ways of, there's a good issue, and if you're interested, email me. Karen O'Donnell has some really good work on this, but there's an issue of modern theology, I think, that talks about other ways of being fruitful that don't entail having children. And so I think what we need to do is re-examine biblical, scriptural, religious, philosophical resources, because there's stuff already there. And to see what we find and how we can kind of repurpose it in ways that that actually accommodate suffering, take it seriously, and allow one to move forward. That was a really long answer. I'm sorry about that, but I hope that was helpful to the person in the chat.
Yeah, thank you very much. I think it has been, the discussion has been as rich as your paper, and it shows very well how different perspectives you can take from, on the one hand, I would say, it can start from arguing when does the person start and how we define it, and actually then very many like stages. Is it at the birth or is it at fertilization, and a lot relates to this, until really how to deal with it, and also the meaning of life, because where you ended, I think we can say that yeah, what is the meaning of life? Some biologists say it is just like reproduce or keep it alive and continue life for something like this. But this can be done also with your books, isn't it? I mean, it's not only kids who carry on your genetic code. It could be also in the same way that you have some kind of good mental thoughts, and these will be traveling to other heads, and you can also yeah, reproduce or fulfill this mission by inspiring other people who will get other good thoughts. So I think this is something that you made, that you inspired many people to think about these things. Yeah.
I should just say on this note, I mean, one of the things I do in my class with my ethics, citizenship, and the exam and life students is we talk in the final unit about being a good ancestor. And the ways in which one can be a good ancestor without procreating, at least, you know, biologically procreating or having children or being a parent. And granted, you know, my Gen Zers are a generation that really don't want to have children and want to think about other things, but they are concerned about making a social contribution, about, you know, doing something that's not just selfish and so on. And so for me, this kind of language around, instead of thinking about tying up with the meaning of life, something with procreation. I mean, as you said, you know, the creation of ideas, producing ideas and so on, but even thinking about it less from the standpoint of production, and thinking about it more from the standpoint of, you know, how can I live in such a way that I leave the world a little bit better than I found it, and I don't create further burdens. Like we're all stuck in the shit. We can't like live pure lives, right? I'm against sort of purity ethics and purity politics and so on. But how can I live in such a way where I'm not burdening the future generation, the next generations, and so on? And thinking about being a good ancestor for me really helps, as opposed to thinking about, you know, Fortpflanzung and reproduction and sort of that as being tied up with what it is to, you know, be a good human being. So
yeah, very interesting. I mean, we have to finish now, but I mean, just by also my last comment, I once actually supervised one BA dissertation of one male philosopher who actually wanted to get an answer whether he should have children, and his dilemma was that he was thinking in a very utilitarian way that bringing more people in the world is not is creating increasing suffering because there will be more pain, and is it at all morally allowed to actually burden the world but also make people suffer because there will be a new person who is going to suffer. So it was very interesting, and it was a huge obligation or burden for me, because he said that depending on the answer to his dissertation, he's going to make his life decision. And it came to me very like as if I were a coach, although I was a supervisor, isn't it? I mean, the roles got actually quite mixed, and I said, actually, I cannot answer your question, and it is your own independent work that is going to do it. But I mean, you may now ask, actually, what was the result of this this big journey to write this BA? And it was interesting that he said that I am now hesitating. In the end, he was not so convinced anymore that this is increasing suffering, but he was also not convinced that this is already answering the question that it is not a morally bad thing to to have more children. So sometimes philosophy is still not, I don't know, if you would call it a help when somebody is seeing more, because philosophy, as we know, is not actually creating answers. It's rather creating the feeling that you don't know. There is more that you are wanting to know. So if you put now the role, my last question would be just from a philosophy work to consultancy. Is it a good result when somebody whom you consult says in the end that actually I am more I know there are more open questions. I'm not confused. I know there are questions, the questions that I have to answer, but I know what the questions are and I know how to get to the answer. Is this the result that the consultancy could bring, or what do you think? And how is it different from philosopher's role?
I mean, not to appeal to more pregnancy stuff, but I do very much like the idea of philosophy as kind of Socratic midwifery, and just in the ways that pregnancy and birth are very, very risky. I think good philosophical midwifery is also risky, and because we don't know what's going to come out on the other end, and we don't know if a person is going to come out more or less kind of satisfied, subjectively satisfied, or what. I think I sort of see myself like in the coaching aspect. I see, I really do want to kind of pursue this idea of midwifery. I'm just here to stand with you, to show you compassion, and to give you some resources and techniques that can allow you to do this on your own, whatever this ends up being. And in this, I want to be Socratic guy, and I just want to buzz around and disrupt and kind of upset some ideas and, try to poke at some things where I see the discourse as being problematic, harmful, whatever. And hopefully, finding some positive alternatives that I can propose in their place. But I think first we need to disrupt the discourse before we can actually correct it. We need to sort of overturn some of that. So that's the scholarly stuff. But I think from the coaching standpoint, that's all we can do. And one of the things that they emphasize in coach training is its non-directiveness. And this comes straight out of the kind of psychiatric and psychotherapy literature. It's supposed to be client-led. There are times, I think, and this is where being a philosopher, I think it is okay to sort of steer the client in a certain direction by giving them certain conceptual tools or readings or things that they can think about. But ultimately, the client is to kind of tell us what they need. And we're supposed to just hold their hand and help them through it. And so that's what I'm struggling with the most as a coach, is not trying to take the reins and solve all the problems for the person, but rather, just accompany them on their way. But I think that's something that philosophy is really, really prepares us well to do if we do it right.
Yeah, thank you very much. I hope I haven't missed any questions. The time is over, but I see also in chat two comments. Great talk. And the other that thank you very much and good luck with the career change. That's a bold and admirable move, is my colleague Green saying. And I think this is how we all feel. So we wish you all the best for your career turn and for your philosophical work that you still have to do. That is going to be also continuing in Susimetsa. So thank you. Thanks a lot and for this talk and sharing your thoughts, and all the best in your future life and your career. So
Thank you
goodbye.
so much. Thanks again for the opportunity. It's great talking to you guys. Take care.